Severe acute respiratory syndrome, SARS, was first discovered in November 2002 in Guangdong Province, China. The disease is caused by a coronavirus called SARS-CoV, which is a member of the same virus family as the common cold. The SARS outbreak spread to several countries and led to significant global concern before it was effectively contained in July 2003. In total, over 8,000 cases were reported, with around 774 deaths. Severe acute respiratory syndrome, SARS, is caused by the SARS-CoV coronavirus. The primary mode of transmission is through respiratory droplets, which are released when an infected person coughs, sneezes, or talks. These droplets can be inhaled by people nearby or can land on surfaces, where the virus can remain viable for some time. Individuals can then become infected by touching these contaminated surfaces and subsequently touching their mouth, nose, or eyes. Close person-to-person contact is the most common route of infection, especially in situations involving close family members, healthcare workers, or others in direct contact with a SARS patient. The virus can also spread through aerosols, which are tiny particles that can remain suspended in the air for an extended period, although this mode of transmission is less common. Additionally, SARS can be transmitted through contact with contaminated objects, such as bedding, clothing, or medical equipment. In rare cases, the virus has been known to spread through fecal-oral transmission, where traces of the virus are present in feces and are ingested, usually as a result of poor hygiene or contaminated food or water sources. Severe acute respiratory syndrome, SARS, is caused by the SARS-CoV coronavirus, which primarily affects the respiratory system. The symptoms of SARS can range from mild to severe and may include the following. High fever. A body temperature above 100.4 degrees Fahrenheit, 38 degrees Celsius, is one of the initial symptoms of SARS, typically developing 2 to 7 days after exposure to the virus. Chills and rigors. Patients may experience chills and shivering as the body responds to the infection. Headache. SARS can cause headaches, which may be mild or severe. Muscle aches and joint pain. Patients may experience generalized muscle aches and pain in the joints, similar to flu-like symptoms. Fatigue and weakness. SARS can cause significant fatigue, weakness, and malaise. Dry cough. A persistent, non-productive cough is a common symptom of SARS, which can progress to more severe respiratory issues. Shortness of breath. As the infection progresses, patients may experience difficulty breathing or shortness of breath due to the virus's impact on the respiratory system. Pneumonia. SARS can cause pneumonia, an infection in one or both lungs, which may result in severe respiratory distress and, in some cases, respiratory failure. Diarrhea. Some patients with SARS may also experience gastrointestinal symptoms like diarrhea. Loss of appetite. Patients may experience a decreased appetite or loss of interest in food. The severity of symptoms can vary among individuals, with some patients experiencing mild symptoms and others developing severe respiratory issues that can be life-threatening. If you suspect you or someone you know has been exposed to SARS or is experiencing symptoms, it's essential to seek medical attention promptly. There is no specific antiviral treatment for severe acute respiratory syndrome, SARS. Treatment primarily involves supportive care to manage and alleviate symptoms, as well as to maintain the proper functioning of the patient's organs and systems. Supportive care for SARS may include oxygen therapy, providing supplemental oxygen to patients with breathing difficulties or low blood oxygen levels can help ensure adequate oxygen supply to the body. Mechanical ventilation. In severe cases, when patients have difficulty breathing on their own or are experiencing respiratory failure, mechanical ventilation may be necessary to support their breathing. Intravenous fluids. Administering fluids intravenously helps maintain hydration and electrolyte balance, which is crucial for overall health and recovery. Medications. While there are no specific antiviral drugs for SARS, medications such as fever reducers and pain relievers can help manage symptoms like fever, headache, and muscle pain. Antibiotics may be prescribed in some cases to treat or prevent secondary bacterial infections but are not effective against the SARS virus itself. Monitoring and supportive care. Regular monitoring of vital signs, such as heart rate, blood pressure, and oxygen saturation, is essential to track the patient's condition and adjust treatment as needed. Supportive care may also involve managing any complications that arise during the course of the illness. It's important to note that the approach to treating SARS patients may vary depending on the severity of their symptoms, the presence of other underlying health conditions, and the specific clinical guidelines in place. During the SARS outbreak in 2002-2003, some experimental treatments were used, such as antiviral medications like ribavirin and corticosteroids to reduce inflammation in the lungs. However, the effectiveness of these treatments remains uncertain, and they are not part of the standard care for SARS. Preventing the spread of the virus through infection control measures, such as isolation of infected individuals and the use of personal protective equipment, PPE, by healthcare workers, is critical in managing and controlling SARS outbreaks.